Good evening, everyone. Myself, Prachi from Homeopathy 360. I'm a second year student of JNHMC and a coordinator for today's webinar. In today's webinar, we are going to talk about advancing science and healing, potential of research in homeopathy. It is my pleasure to introduce our today's speaker, Dr. Suraj Singh Bhadoria. He is the assistant professor in Department of Homeopathic Pharmacy at Parul Institute of Homeopathy and Research at Parul University, Vadodara, Gujarat. Sir, it is a pleasure to have you on this platform. Now, I would like to hand over it to you, sir, and request you to please begin our today's webinar.
Okay, ma'am. Thank you, ma'am. This is a great pleasure to explore my work and the knowledge with you. So, can you just zoom it this PPT?
Yes, sir, yes.
Moving to next slide. Now, as we know, the research is a huge branch. It is just like a sea. Previous slide. So, we started, inaugurated our own research unit. It is our research platform which started from JNHMC, and now it started with the PIHR, Parul Institute of Homeopathy and Research, along with JNHMC. We inaugurate this research unit on 21st December 2023. And the main aim and the objective of this research unit is to nourish the BHMS and PG students towards the research work in homeopathy. Moving to next slide. Now, the main aim is to nourish the students, just like a seed, water, a nutrient value. As we know, we all are doctors, we all are a fraternity of this homeopathy. So, we want to nourish our students in terms of communication skill, in terms of their knowledge, in terms of various experiences, in terms of research aptitude, in terms of general communication in relation with the homeopathy and research, because research is not something a new kind. Research is always linked with every subject and every matter. So it is very important to nourish our students, especially the BHMS students, towards the research work. Next slide. Now the objectives are: first, using various instruments like UV spectrophotometer, FTIR, which is IR spectroscopy, chromatographic technique for this type of analysis. Because ultimately, this pharmacy is a separate branch. Because when we talk about pharmacy, so it is a mother of every science, because it gives you a complete, a holistic knowledge of a drug, a remedy, a medicine. So to know about the drug, we have to know about their various method of standardization by various tools. So what we can do, we have to just analyze and doing standardization by various applications. The another thing is doing standardization by different methods. The third one is patent formulation. We also publish patent from the Department of Homeopathic Pharmacy, from the Home Research Unit, in the whole aspect of various formulations in homeopathic pharmacy. At the end, we talk about the drug development. Next slide. Now, what are the devices which are commonly used for the standardization? The devices are UV visible spectroscopy, which is commonly used for the standardization in terms of concentration. The second is FTIR, which is IR spectroscopy. It is used to determine the various functional groups. Raman spectroscopy, it is very sensitive and very important spectroscopy in terms of hydrogen and OH vibrational frequency determination. It is discovered and founded by Dr. C.V. Raman. HPTLC, it is the chromatographic analysis. For every pigments, for every fingerprinting, we need the chromatography. So it gives both qualitative assessment and the quantitative assessment. XRD, it is still available in our micro nano lab of Parul University, that is X-ray diffractometer. So it works on the determination of various composition of salts in our solvent or in our samples. And SAM, it is again a very sensitive instrument. This is scanning electron microscope, which is a type of electron microscope. It is used to determine the various minute and microstructures under the microns, under the certain nanometers. So these are the very common techniques which are used to standardize, which are used to quantify, which are used to qualify the drug substances. Next slide. Now, this is our first article from BHMS students. The main title of this research work is to prepare the cantharis glycerol or a glycerin at different ratios like 1 gem 1, 1 gem 4 and 1 gem 9. So these are the different ratios in which the cantharis glycerin were prepared, and the standardization were done by UV spectrophotometer and the FTIR. So here what we are doing, we prepare glycerol in different ratios, and after preparing this glycerol by Cantharis mother tincture, we analyze the Cantharis glycerol at different ratio in terms of their concentration, in terms of their qualification, in terms of their FTIR or functional group determination. Afterward, we found that the absorption capacity of this Cantharis glycerol, uh, which is found at 278 nm, around 0.741, and somewhere in 1 raised to 9 it found as 0.987 at 333 nm, whereas in 1 gem 4 it found around 0.997 at 368 nm. So these are the different methods of determination of concentration of Cantharis mother tincture in the glycerol, which is used as a vehicle for this type of preparation, and it is published in the international journal, and the main author is Chauhan Harish Singh, Harji Bhai, Parmar Vasant Kumar, and Ganpat Singh. So these are our students from JNHMC, and they are publishing this research work in the international platform. Moving towards the next slide. Next slide. Yes. Formulation of standard hypericum perforatum, Arnica montana, and Azadiracta indica mother tincture as a lotion with different proportion and quality control. So here we completed this work with the BHMS student Thakkar Khushi Nimesh Kumar. And the main aspect of this research work is to prepare the different lotion in a different proportion with the standardization done by FTIR and UV visible spectroscopy. So here what we are going to do, we are going to compare the different mother tincture in a same media, which is our distilled water in a lotion preparation. So we are standardizing this different mother tincture in a same base in a different ratio by concentration and by determining various functional groups. So this is completed under the CR40 department, that is Center of Research and Development in the Parul University. And the main co-author of this research work is Dr. Monimala Pramanik Madam. She is associated in the Department of Homeopathic Pharmacy in JNHMC Parul University. So it is again a very different aspect of preparing the lotion with different mother tincture with standardization by the UV spectrophotometer in terms of concentration and FTIR analysis. Again, it is published in the international journal for showcasing this research work. Next slide. Now, the another research work is formulation of Arnica montana glycerol from standard Arnica montana mother tincture by UV visible spectrophotometer. So here we prepare a glycerol by Arnica montana mother tincture, And after preparing this, the standardization were done by UV visible spectrophotometer. And the main author of this research work is Prateek Bharat, a student of BHMS from JNHMC. And the main author of this research work is Dr. Monimala Pramanik Madam. She is our associate professor in the Department of Homeopathic Pharmacy from JNHMC. And Dr. Purav Desai sir, he is our dean and principal in Parul University, Vadodara, Gujarat. So here we simply prepare a glycerin, which is medicated by the Annika Montana mother teacher. After preparing it in 1:9 ratio, we standardize it by UV visible spectrophotometer. Moving towards the next slide. Now, here we compare the absorption capacity of lotion by the standard mother tincture, which is belladonna, and iris versicolor mother tincture, which is procured from GMP certified pharmaceutical company. Again, it is completed by our BHMS student from JNHMC, Jaipur Pratik Bharat. And while preparing this lotion, uh, we compare the absorption capacity and the lambda max value of belladonna mother tincture and iris versicolor mother tincture in the aqueous base. So this is our main objective and aim of this research work. And we found that the absorption of belladonna Q is around 0.831 at 380 nm, whereas the standard and the lambda max of iris vesicular Q is 0.740 at 350 nm. So these are the different absorption of different mother tincture by UV visible spectrophotometer. And again, we publish this work in the International Journal of Pharmaceutical Sciences. So this is again another aspect of standardization in homeopathic medicines or external applications. Next slide. Now, this is a comparative study of a lotion which is prepared by a mixed variety by Thuja occidentalis Q and Allium cepa Q. Generally, in law of simplex, we thought about only single remedy at a time. But here in this external application, we mix this two different mother tincture with two different family in a same base, which is our aqua distill in a definite proportion. The proportion is 1:9. So here we found that the absorption capacity or the lambda max value of this allium cepa Q is around 0.992 at 410 nm, whereas Thuja occidentalis Q is around 0.995 at 571 nm. So different absorption at different wavelength due to different alkaloidal property, due to different phytoconstituents, due to different concentration or the media of that particular drug substances. And this particular external application, it is standardized by the UV visible spectrophotometer and FTIR. UV visible for determining their concentration and FTIR for determining the various functional groups. So again, it is published in an international chemistry journal to explore this knowledge in whole worldwide and to explore the beauty of homeopathic external applications also by various method of standardization. The main author of this research work is Ishan Thumar. Moving towards next slide. Now, this is comparative analysis of gingiber officinalis lotion in a different ratio. What are the different ratio? 1:1 and 1:5 and 1:9. So these are the different ratio we use to prepare this lotion by mixing the gingiber officinalis lotion, gingiber officinalis mother tincture, which procure from GMP certified pharmaceutical company, and the standardization were done by again same instrument, that is UV visible spectrophotometer, double beam, and FTIR for determining the concentration and the functional groups of this particular phytoconstituent in the base of distilled water. So what we found? We found that the concentration of this gingiber officinalis in the aqua distill were determined by the UV visible spectrophotometer, and different functional groups like phenols and amino acids, alkalines, carbohydrate. These all are were determined by FTIR analysis, and it is also published in a standard international pharmaceutical journal from a clinic publication. And the main author of this work is Anuba Nanda from BHMS student JNHMs. Moving towards the next slide. Now this is comparative analysis of Hypericum perforatum liniment. Now this is liniment. Previously, these all are like a lotions and glycerol. Now it is a liniment, which is oil based in a different ratio, and the quality control done by FTIR and UV visible spectrophotometer. So here we mix this Hypericum perforatum Q, which is procured from GMP certified pharmaceutical company, in a olive oil base, because liniment generally it is having oil base. So we prepare it and we standardize this liniment by UV spectrophotometer, double beam, and FTIR by CR4D, Center of Research and Development in our Parul University. And we found that after data analysis, the absorption capacity of Hypericum perforatum liniment, which is prepared in Benjamin 4, or drug vehicle ratio, which is 1 and 4, it gives better result in analysis in terms of concentration, in terms of determining various functional groups, as compared to the other ratio like 1 and 1 So here we compare same drug in a different ratio, in a different proportion, along with our base, along with our vehicle, by UV spectrophotometer and FTIR. And it is again published in an international journal. So this is a very novel work. It is completed by Desai Swapnil Rajesh Kumar, a BHMS student from JNHMC, Parul University, Vadodara, Gujarat. Moving towards the next slide. Now, this is a comparing a concentration and functional group of osmum centum glycerol in a different ratio, like 1 1 4 9. So we prepare this glycerol by Osmum centum mother tincture, which is again procured from GMP certified pharmaceutical company. And the standardization were done by UV spectrophotometer and FTIR by CR4D department. So we found that this Bunjem 4 ratio of this Osmum centum where gives the significant result in terms of concentration, in terms of determining various functional groups as compared to 1 and 1 So this is just a comparative analysis of same external application in a different proportion. So again, it is published in an international chemistry journal by Jigar Kumar Dinesh Bhai, and the main co-author of this research work is Dr. Monimala Pramanik Madam. She is associate professor in the Department of Homeopathic Pharmacy from Jawaharlal Nehru Homeopathic Medical College, Parul University, Vadodara, Gujarat. Next slide. Now, this is comparing the quality assessment of Ruta G lignocaine jelly by UV spectrophotometer and FTIR. So what we prepared a jelly, a lignocaine jelly, which is used for general local anesthesia or certain types of eruptions on dermis, by mixing this drug substance, which is Ruta G mother tincture, procured from GMP certified pharmaceutical company, and the standardization were done by UV vis spectrophotometer, double beam, and FTIR. And again, this external application prepared in a different drug vehicle ratio. The drug vehicle ratio is 1 4, and 1 Now, what we found, the absorption capacity of Ruta G mother tincture is 0.394 at 598, whereas the Ruta G Lignocaine jelly at 1 gem 1 is 0.712 at 598 nm, whereas in 1 gem 4, this lignocaine jelly absorption is 1.707 at 554 nm, whereas this absorption of Ruta G jelly at 1 gem 9 is around 1.509 at 555 nm. So these are the different absorption of same drug in a different drug vehicle ratio in a different proportion by UV visible spectrophotometer. And in FTR analysis, we found that there is a presence of alkalines, alkanes, and alkyl halides. So these are the various functional groups which are significantly seen in the Ruta G lignocaine jelly in a different proportion 1 gem 1, 1 gem 4, and 1 gem 9. And again, we published this work in an international chemistry and the pharmacy journal by a Connect publication. And the main author of this whole work is our BHMS student Sathar Ektaben Pankaj Kumar. So this is our first year BHMS student. Next slide. Now, the another research work is prepared Thuja occidentalis glycerol with the quality assessment done by UV visible spectrophotometer and FTIR. So we prepared a glycerol by mixing Thuja occidentalis mother tincture, which is procured from GMP certified pharmaceutical company, in a proportion of 1 gem 1, 1 gem 4, and 1 gem 9. Now here you can see we are not using a single drug vehicle ratio, which is given by our pharmacopoeia. We use or prepare in a different proportion, like 1 gem 1, 1 gem 4, 1 gem 9. So this will give you the significant difference in terms of their concentration, in terms of determining their significant functional growth by FTIR. So this type of research work should be needed. Every time it is not necessary that we follow some rules and regulations, some guidelines and the principles. The novelty is that when we discover some new drug vehicle ratio and when we publish it and when we get some significant result of this, so this will give you a remarkable change in our research work, especially when we talk about this pharmaceutical preparations. So again, it is published in a international pharmacy and chemistry journal by Academic publications. And the main author of this research work is Sagar Kumar Balan, and the main co-guide of this research work is Dr. G.S. Chakravarti. He is the principal in PIPR, Parul Institute of Pharmacy and Research in Parul University, Vadodara, Gujarat. Next slide. Now, this is a spectrophotometric analysis of Sesaism gembolenum olive oil by UV visible spectrophotometer. So here we prepare this olive oil by mixing the mother tincture of Sesaism gembolenum, which is commonly used drug for diabetes mellitus. So we prepare this olive oil by Sesaism gembolenum and standardize it by UV visible spectrophotometer. The drug vehicle proportion is 1 gem 9, 1 part of drug and 9 part of vehicle, which is olive oil. And the absorption capacity of this Sesaism gembolenum cube is 0.761 at 663 nm, and the uh, Sesaism gembolenum olive oil is 3.255 at 670 nm. So standardization were completed by a UV visible spectrophotometer in terms of the lambda max or the concentration of that particular drug substance in the vehicle of olive oil. And it is published in an international journal of pharmaceutical sciences to explore this research work in a global or international platform. And the main author of this research work is Manan Shah. He is a student of BHMS second year from PIHR, Parul Institute of Homeopathy and Research from Parul University, Vadodara, Gujarat. Next slide. This is a comparative analysis of Hypericum perforatum Q and petroleum mother solution in sandalwood oil. So here we use sandalwood oil as a vehicle, and the standardization were done by UV visible spectrophotometer. So what we are going to do, we prepare this sandalwood oil, which is medicated by Hypericum perforatum Q, which is procured from GMP certified pharmaceutical company. And what we found that the absorption capacity of this Hypericum perforatum Q is 0.997 at 596 nm, whereas petroleum mother solution is around 0.221 nm, 221 at 400 nm. And Hypericum perforatum sandalwood oil, the absorption is 0.972 at 420 nm. So here we found that when we prepare this, so we significantly identify the concentration of Hypericum mother tincture in the base of sandalwood oil at different wavelength. So this is the main aspect of this research work, and it is again published in an international Journal of Pharmaceutical Sciences. And the main author of this work is again Manan Shah from BHMS student, second year, Parul Institute of Homeopathy and Research, Parul University, Vadodara, Gujarat. Next slide. Now, this is a comparative analysis of lotion which is prepared by a simplex variety or complex variety by Allium cepa mother tincture and Allium sativa mother tincture in a different drug vehicle ratio. And again, the standardization were done by UV visible spectrophotometer and FTIR. So here we prepare this Allium cepa and Allium sativa mother tincture in a lotion in a aqueous base with simplex variety and complex variety in a drug vehicle ratio of 1:9. So we found that simplex variety will give you the more significant result in terms of concentration, in terms of determining various functional groups by FTIR analysis. So this will give you a comparative differences in the complex and the simplex variety of various external applications. Generally, we found that in a market, there are certain applications, there are certain external applications which are commonly used, like hair oil. So sometimes in this hair oil, there are a complex variety of drug substances, more than one. And sometime in a single or simplex variety, there is a single drug. So how we are going to standardize this drug in a same base with the complex and simplex variety? So we also completed this work, and what we found that this simplex variety will be more feasible in terms of this complex variety, because different drug having different drug vehicle composition, having different phytoconstituents, having different family, having different active principles, having different heterogeneity in their biomolecular system. So they will give you a very different aspect of zone in a concentration and in a functional group. So this is a main research work. It is again published by Jinal Parmar, who is a student of BHMS in JNHMC, Jawaharlal Nehru Homeopathic Medical College from Parul University, Gujarat. And again, it is published in an international pharmaceutical journal. Next slide. Now, this is a comparative analysis of gingiva officinalis lotion in a different ratio. Now, what are the different ratios? We prepare this gingiva officinalis in 1:9, 1:1, and 1:5 with the same base, that is aqua distilled. So we found that the formulation of gingiva officinalis lotion in 1:9 will be one of the most better and significant in terms of concentration, in terms of determining various functional groups as compared to 1:1 and 1:5. So that's why we always use this drug vehicle ratio, that is 1:9. So this will be a very conclusive significance or a result of this proportion. So always preparing our lotions or external applications with different ratios and compare it in terms of their concentration, compare it in terms of their functional group, compare it in terms of their microstructures, compare it in terms of their different chromatographic fingerprintings. So we can have conclusive and evidence-based practices to show the good and significant value of that particular drug vehicle ratio. So again, it is published in an international journal, Pharmacy Journal, and the main author is Anuba Nanda from BHMS, Jawaharlal Nehru Homeopathic Medical College, Parul University, Vadodara, Gujarat. Next slide. Now, previously we had all this standardization by UV, by FTIR, by chromatography with different drugs, with different medicine in a different ratio, in a different vehicle. So after finishing this work, we enter into the nanoparticles. It is very sensitive and very controversial part in our homeopathy because our medicine is already ultra high diluted. It is above the Avogadro number. So how we bring this mass particle in our massless ultra high dilution? So we started our journey from nanotechnology. Next slide. Now, synthesizing the nanostructures of complex preparation by Stephisagria Q and Cantharis Q under the influence of potentization. So this is again completed by Baria Drasti Umesh. She is our first year BHMS student, first year student, not MD student, not PhD student, PhD scholar. She is our first year student. She mixes Cantharis mother tincture and Stephisagria mother tincture in a base of distilled water and using a chemical method to synthesizing nanoparticles, because for synthesizing nanoparticles we have a different methodology, the chemical method, physical method, biological method, emulsions. So she uses the chemical method. The main ingredient for preparing this nanoparticle is potassium ferrocyanide. So she uses this potassium ferrocyanide for synthesizing nanoparticles in a complex variety of Staphysagra Q and Cantharis Q. And standardization were done by SEM because SEM is a part of electron microscope. So this will give you a significant structural pattern of the particle size in a different micron, in a different nanometer. So it is completed in the Department of Micro Nano Lab in the Parul University, and it is completed under our main Dean of Faculty of Homeopathy, Dr. Purav Desai sir. So this work is again published in an international journal of pharmacy, and it is very novel work because even though when I was in BHMS, so this nanoparticles and completed work in nanotechnology, and not only completed, also published it, is a very challenging job. I am very happy and very, what we can say, there is no word to explain this whole research work because first year student doing nano is very far away. Now there is no boundary. Next. Now, again, it is very challenging. Nanoparticles in mother tincture is somewhere it is feasible because mother tincture is a crude. It has some atomic and the molecular structures and the ionic properties. But in 1M with nosode, sorinum, by the chemical method, same method we use and potentize it, it is again very challenging job. And we completed this work under the Dr. Sandhya Vasant Garge. She is assistant professor in the Department of Obs Gynae from Bharati Vidyapeeth, Deemed to be University, Pune, Maharashtra. And we found that in 1M, we create some mass particle, which is nanostructure in a micron, and not only preparing this, standardizing it by the electron microscope, SEM, scanning electron microscope in Chicard lab in Anand, Gujarat, and also publish it in a Homeobook website. So you can see this. Next slide. Now these are the microstructures in Sorinum 1M. Now you can see this Sorinum 1M nanoparticles in a very micro and minute, like a star. So this is again a very challenging job because in 1M it is already ultra high diluted. So to prepare this, it is very, very difficult for us. So again, we completed this work and published it. Next slide. Now this is nanoparticles of Steffi Zagria, mother tincture, and Cantheris mother tincture by Drusty Baria in 1 μm. So this is just like a small scattered crystalline growth. So these are the appearance of nanoparticles, because in a different drug, in a different solvent, in a different system, they have a different arrangement and the pattern. So this is Steffi Zagria and Cantheris Q nanoparticles. Next slide. Now this is again Steffi Zagria and Cantheris Q, just like spreading of crystals on the floor of leaflet. So this is the appearance of these nanoparticles in a different micron, in a different particle size. They have a different pattern of arrangement. So this is one of the beauty of nanoparticles. Next slide. Now these are our BHMS students from JNHMC. They completed research work in synthesizing nanoparticles in Helianthus Q, which is prepared by sunflower, and not only completed this but also publish it in an international journal. So we completed this work by our student of BHMS JNHMC, and they prepare nanoparticle under the process of potentization by 100 downward strokes, equal strength. And the main core and the method of this synthesizing nanoparticles is potassium perocyanate, which is generally used as a biocatalyst for synthesizing various microstructures. Next slide. Now, she's our BHMS student, Drusty Baria, while preparing nanoparticles, while synthesizing nanoparticles, and standardizing nanoparticles by UV spectrophotometer under the influence of hot air, hot water bath for digestion. Next slide. Next slide. Yes, now this is FTIR machine. Now this FTIR machine, it is very, very commonly used for the standardization of the various medicinal substances, drug substances, and various external applications, various solvent systems in terms of functional groups. So you can determine various functional groups like alkaline and some other phenolic contents, carboxyl groups. So this is our main instrument. It is available in our pharmacy college also, and our CR4D department, that is Center of Research and Development in the Paru University. And he is our first year BHMS student, Manansha. So they prepare it and standardize it by TI. Next slide. Now, see what today we learn. We learn that a nourishment of BHMS students, nourishment in terms of their research attitude, nourishment in terms of their communication skill, nourishment in terms of their intellectual property, nourishment in terms of their knowledge, nourishment in terms of their basics. These are very, very important parts, because ultimately now homeopathy is still not a evidence-based medicine. Even in Wikipedia, you can see homeopathy is a pseudoscience. So this is a duty of every homeopath. Either they are in academic part, administrative part, or some other clinical part or research area. We have to justify our pathy in terms of evidence-based medicine. I know these works are very basic. These are very preliminary. They are very, very like started with 0 day. But we have to start this work with our BHMS system, because when we started our work, so everyone says that no, research is always in a PG section, not in a bachelor section. It should be in a PG or PhD section. But why? Even though when we learn about AI tools, so there is no qualification in any type of degree and diploma courses. So please try to understand this. When we are in homeopathy, even though our science is very miracle and very excellent in terms of their analysis, in terms of their repertorial approach, in terms of their cure, in terms of their Herring's law, but again, it is not evidence-based medicine. So what we are doing nothing. We are just doing a copy-paste system. So we have to change ourselves. We have to start our work with our students, especially the BHMS students. I thought that BHMS students are more potent as compared to any other student because they don't know. If we don't know, so we want to know. So if we want to know, so definitely we will do more work. In PG, what happened? We know everything, so we don't want to know. So definitely by knowing, we does not want to do more work. And in PhD, it is very superior. Uh, Everything is knowing, so we don't want to do anything. So this is a general concept of a human mentality. So I this is my personal experience. It may vary from person to person, but this is my experience that this advancement and the research work is very potent in our BHMS students. Yes, MD students and PhD students, they are also more potent, but we have to start our work from BHMS students. So this is my today's presentation. I want to conclude that part that we are not just doing research, we are not just standardizing the work, we also publish it in in a reputed index peer review international journal, in a pharmaceutical domain, in a pharmacy journal, in a biology journal. So this is a very huge victory of Parul University, especially the JNHMC students, because I started my work from JNHMC. When I joined this JNHMC as an assistant professor, so we started this our work. So we started our work from JNSMC, and again it carried by PIHR, and again it is a continuous process. The JNHMC students, they are again a very hard working, they are more potent, and PIHR students, they are also doing the same work. So this is objective of our own research unit. We started this research unit. So the main objective of this unit is to nourish our students in terms of research work, in terms of advancement, in terms of their uh, what we can say uh, field, so they can we do more and more better work in future perspective. So at the end, I conclude this part. Research, it always begins from 0 degree. It is not always 100 degree or 100%. So it is an ongoing process. So thank you to Parul University. Thank you to CR4D, that is Center of Research and Development in the Parul University. Thank you to our Dean, Dr. Purab Desai sir, who always encourage our students. Thanks to our principal, Dr. BP Panda sir. Thanks to our trustee, Dr. Komal Patel madam, Dr. Parul Patel madam, Dr. Gitika madam, and Dr. Devanshu sir, for completing and giving this opportunity for our students. Thank you so much.
Thank you very much, sir, for your enlightening session. Next, I would request the participants if they have any doubts or queries, please feel free to ask Dr. Suraj, sir. If any participants is having any doubt, you can freely ask. No, then I would like to conclude our today's session. I want to express our sincere gratitude to Dr. Suraj sir for delivering such an outstanding presentation. We sincerely appreciate your participation in today's event. Also, a very big thank you to the audience for listening and learning. And lastly, to the entire organizing team for ensuring everything ran smoothly. Just a gentle reminder, lastly, the recording of today's webinar will be available on YouTube channel of Homeopathy 360. If you want, you can check it out later on. Thank you all, and I wish you all a great day ahead. Thank you, sir.
Thank you, ma'am. Thank you so much, ma'am.